Now, in a bid to strengthen its fight against COVID, the government of India began its vaccination drive for children aged 12 to 14 from today. The condition of comorbidity for people above 60 years has now been removed and they can get a precautionary dose. Everyone in this age category can now take their booster shots. The COVID vaccine will be administered to 12 to 14 years. That vaccine would be Corbevax, manufactured by Biological E. And we'll try and get you voices from across India. I'm joined by my reporters who are covering and who are getting voices from ground. I'm joined by Ayushman from Delhi, Disha in Mumbai, and Mugilan in Chennai. In fact, let me first go across to the national capital. Ayushman, so how has it been there? What's the response? What are the children saying? What are the senior citizens saying to get their third shot and children getting their first shot? How has the response been like in Delhi since morning?
Well, if you take the national picture here on the COVID dashboard, more than 27,000 children have taken the vaccine on the very first day. It's the Corbevax vaccine which we are talking about, and this vaccine has been first given to the children age group of 12 to 14. Many of the parents whom we spoke to came onto the vaccination site because both registration and the walk-in were allowed. Was because of the factor that the students have been out of the schools for a very long period of time, and given the record that we are seeing of the vaccination, it was important for them to get their child inoculated. So on the very first day, more than 27,000 children have been vaccinated in the age group of 12 to 14. Also, an important development which has taken place is that the comorbidity condition above 60 years age group, that has been removed. So that is for the precaution dose. So currently, if you see, the situation is that both in the above 60 age groups, the precaution dose is allowed, and in the adolescents group, more than 27,000 vaccination has been given on the very first day, and the center has already said that it's for states to check that even those children who were born in the year 2010, their date will be properly seen, and nobody below the age of 12 years will be given the vaccine.
Ayushman, thank you for joining us with those details. Let me now go across to Disha, who's joining me from Mumbai. Disha, what's the scene in Mumbai? What has been the response? Have there been many kids who are turning up for their first dose since morning?
Well, Charlene, as far as Mumbai is concerned, today at 12 dedicated centers, the vaccination for children 12 to 14 was conducted. And in fact, the vaccination started a bit late. It was supposed to start at 12 p.m. But in Mumbai, in all of these centers, the vaccination started only at about 2 p.m. and it was shut by 5 p.m. as per the scheduled time. So only for 3 hours, the vaccination did really take place. And when we visited one or two centers, we also spoke to a few dean of the centers who really said that on the first day the response was little low, the turnout was little less compared to, of course, what we saw earlier as far as 15 to 17 age group is concerned. In fact, today in the morning when I was reporting from Rajawadi Hospital, which was one of the vaccinated center, we saw only about 8 to 9 kids turning up for the first shot. So definitely it's still a first day. There are a lot of hiccups as well as far as, children are concerned, whether to go and take it, whether to not go and take it, because that was a conversation we were having with the kids and the parents. So definitely BMC says that we do not really have an overall figure at this point in time because the vaccination was shut only at about 5 p.m. So it is too soon to talk about the numbers as far as how many children got vaccinated today in Mumbai and across the state. But of course, the first day response the turnout was a little bit low is what the BMC is saying at this point.
Right. So in Mumbai, we did see a slow start to this 12 to 14 age group vaccination drive. Let's also look at the scenes in Tamil Nadu. Let me go across to Mugilan, who's reporting from Chennai. Mugilan, we know that, the Tamil Nadu Health Secretary said that about 21.6 lakh Corbevax doses were reserved for this particular age group in the state. What are the additional arrangements that are in place, say, from the drive that, of course, began today and that will be carried forward from tomorrow?
As far as the vaccination drives are concerned, in Tamil Nadu it can be divided into three, that is 18 plus and above, 15 plus and above, and now 12 plus and above. Because as far as the 18 plus are concerned, we have seen there was a laxity among people, and people were not really coming forward to take up the vaccine. As far as today's data is concerned, above 18 age category is concerned, 91% of the beneficiaries have taken their first dose, and only 74% of the beneficiaries have taken second dose. And as when we speak about the precautionary dose, it is still well below 70% is what we are hearing from the health department. But otherwise, when we take about 15 to 17 age category, there is a very great enthusiasm among students to come forward and take up the vaccine in a very short span of time. That is, as soon as the vaccination drive was started for this particular age category, we have seen the the great number of beneficiaries came forward and took up the vaccine. As of today, more than 84% of the total beneficiaries between this 15 to 17 age category are vaccinated. And when we speak about the second dose, it has crossed 70%. So there is a great enthusiasm among the youngsters, among these age category people. And likewise, the 12 to 14 age category also, today it started in Tamil Nadu, it started in schools, and we could see several students, at least in the COVID vaccination center where we were, there are at least 100 students who were there to take up the vaccine. So the enthusiasm among this age bracket is very much visible, and we can expect these eligible beneficiaries to come forward and take up the vaccine at the earliest. And as far as Tamil Nadu is concerned, 21.21 lakh beneficiaries has been identified, and as you rightly point out, the health secretary also have said that 2.6 lakh vaccines are available with the Tamil Nadu state government, and they have set the target to vaccinate this population, that is 12 to 14 age category, within 1 month is the target that's been set by the Tamil Nadu Health Department. Because in the 15 to 18 age category also, we have seen the vaccination was done at the school itself. So it gave a greater opportunity for the health department officials to vaccinate large number of students at a given point of time. And likewise, for the 12 to 14 age category also, the vaccination will be done at the school or any educational institute itself. So this helps the health department to vaccinate the maximum number of students is what we are hearing from the health department officials. And moreover, when we speak about this vaccine for the 12 to 14 age category, what we could understand from the health department officials is that there is no need for consent from the parents. So this makes the vaccination drive more hassle-free is what we are hearing. So they they say that they are confident that they can vaccinate the maximum number of beneficiaries between the 12 to 14 12 to 14 age category within 1 month is what we are hearing from the health department. Yes, there are several beneficiaries who are outside the schooling system or the educational system. So now they are in touch with the revenue department also to identify the beneficiaries who are left from this system, and steps are being taken to vaccinate them also. So the health department officials, they say that they are confident that they can vaccinate this particular age category in 1 month is what we are hearing from the officials.
That's right, Mughal, as you rightly pointed out, that there is enthusiasm among children to go and get their first shot. And just to highlight to our viewers that this is Corbevax vaccine, which is India's indigenously developed vaccine by Biological E. It is safe for children as it uses small fragments of the vaccine. And as Mughal was pointing out, that the Tamil Nadu government has put in place certain protocols and measures and advisories for children. In fact, let's listen into what the Tamil Nadu Health Secretary had to say over this drive.
21.21 lakhs between these two age groups. The Government of India has given very clear directions on how to go about it. Basically, we are giving this, they have supplied sufficient 21.6 lakh doses of Corbevax vaccine to us. These are in 20 doses, 0.5 ml per vial as 20 doses. And it has to be given in IM, and here we have started that program. Throughout Tamil Nadu it has been started. And we have also told our people, while registration between 12 to 14 is also possible, walk-in is possible, to facilitate in the schools, we have RBSK vehicles and the teams, like we did for 15 to 18 years. We have told the block level medical officers to identify all the schools, government aided, private and CBSE, and organize this vaccine. I am sure just like 15 to 18 years, we had a very good response in the schools. This time also we'll have a good response. The only challenge with 15 and 18 also, those who are outside school. So that also we are enumerating.